we just wanted to say welcome to the next installment of the Fertility Diaries by HART. And today I'm very, very excited to introduce our fabulous guests, Kirby and Tara. So Kirby Hendricks is our dietitian, our resident dietitian, and Tara is our resident yoga expert instructor. As we know, February is Reproductive Health Month, so we're hosting 4 live events throughout February, and then interviewing our expert fertility, experts in the fertility field. So thanks for joining me this afternoon, ladies. I really appreciate your time.
Thank you.
And we really thought it would be an amazing synergy to have the two of you, because as you know, diet and yoga are 2 very important things on a holistic level, as well as a physical, emotional, and soulful well-being level. So I wanted to just first of all give you guys an opportunity to introduce yourselves. So Kirby, can we start with you in terms of how you came into sort of nutrition? And I know that you've got an amazing field of expertise, but especially in the PCOS, polycystic ovary syndrome, and endometriosis and infertility as a whole. So could you chat about that, please?
Sure. Big question. So I talk a lot, so just let me know when I should stop.
Yeah, we love that.
So I've been in private practice for 7 years now, going on 8 years. But growing up, especially when you notice your family members are sick and they're on all these medications and they're on baskets of medications, I always thought, clearly this isn't normal. This is not how it should be. There has to be another way. To me, at the time, the only thing that made sense was what you do on a daily basis, and that's food, and that's eating. So my love for food really came at a very young age. And then a couple of years into private practice, I was diagnosed with PCOS. Mentally, I knew it was coming because I struggled with my menstrual cycle since the age of 13. So it was just a terrible experience for me. And in my mind, I always thought it was either PCOS. Because of my background, I always thought it was either PCOS or endometriosis. And then a couple of years later, I was diagnosed with PCOS. But the whole experience was extremely frustrating for me, especially because of what I know now. So, of course, when you were younger, and I even find this today in practice, and I don't know if you guys can relate, but I find that a lot of patients that I see don't actually understand what their menstrual cycle is and what it actually means. So I'm having to explain that to a lot of my patients. And also, I'm generalizing, but I wasn't brought up with the knowledge of what a menstrual cycle is and what you have to look out for and what you're going to experience. And obviously my poor mother didn't know any better either, because that, you have your cycle and all you were told is you are becoming a woman,
Yeah.
So, and the thing with that is, when I experienced all the heavy menstrual cycles or the painful menstrual cycles where I couldn't barely walk, it was normal because we didn't really know anything else. So, and then when we have PCOS, we've got the added symptoms of hirsutism or headaches or fatigue or mood swings, but it all becomes normal because no one's really talking about that. So, and I also remember when I was 13 years old, having those painful periods, the doctor immediately suggested, I think I was 13, the doctor immediately suggested that I go on to the pill or the contraceptive. And my mother refused, not because of the pill or the consequence thereof, just because of the fact that, she's on the pill, so she might fall pregnant. So that was it. So luckily for me, I didn't go on the contraceptive, but it wasn't because of the consequences. And while I was going through my own experience, I also started seeing a lot more females. I feel like I was drawn to the PCOS patient or the endometriosis patient or a patient struggling with PCOS and insulin resistance or infertility. So I was just naturally drawn to that type of patient. And of course, my background in nutrition and genetics, I just didn't think it was spoken about enough. Certainly when I was diagnosed, there wasn't much to go on. But I'm just so happy that we're doing this today because people need to understand how important nutrition is in fertility. So I'm glad we're creating a space for that.
I'm very happy too.
Yeah.
And Tara, yourself, we're very interested to understand how you came into the practice of not only yoga, but specifically fertility yoga, and why you chose that path in terms of your holistic practice.
Yes, so basically for me, I've been a yogi, a movement specialist, a dancer for over almost my whole life, but yoga and such only for like the past 12, 15 years. It has been something that I do for my personal practice. And I've really honed into fertility and prenatal and postnatal because ever since having my own kids, I just feel like it's so important to have movement in your life that's not, it's not rigid gym, and it's not saying you have to be muscular or you have to be this to do yoga, Yoga is for everybody. You can be a beginner, you can be old, you can be young, you can be, whatever it is. But I've decided to specialize in this field because it's so important for moms to be holistically whole. The fertility journey is not an easy one.
Yes.
You have lots of downfalls. You have lots of ups and downs in terms of will it work, will it not work? There's lots of things happening within that sphere as well. Is my husband's sperm okay? Is my womb okay? Are my ovaries okay? And it just leaves so much tension and emotional trauma that you face as a woman. And yoga for me just puts you into a space where you learn to trust your body. And trusting your body is important for the fertility journey because you have to trust that you are capable of doing this in terms of your cycle, in terms of endometriosis and all the reproductive illnesses that people face these days. Yoga really allows you just to learn to trust your natural ability to live as a normal human being, that you are not different, that we all come together in a group of people who are like-minded to share as well certain aspects of ourselves together. So my yoga classes are not traditional, it's very focused on honing into the type of class we are dealing with. So in a fertility session, talking about how you are reacting to the treatment, how you're feeling emotionally, and you just feel like you have a support system, to really take you through this journey. And as you go into prenatal, as you go to postnatal, you really just have a support system of like-minded people who understand where you're at in your journey.
Okay, that's great. So we've had a lot of questions come in, so I'm very excited about this across all of our social media platforms and our WhatsApp. So I want to get started. First of all, Tara, this one's for you that's come through. What exactly is fertility yoga? I know that you've just touched on that, but can you just elaborate a bit more how it's different from your mainstream yoga in terms of poses or what you can and can't do?
All right, so fertility yoga is focusing on postures that stimulate and just feel into your womb space, feel into your abdominal area, and it works a lot more on emotional side. And so it's not difficult postures, but it's postures that allow you to really trust your body like I said, the trusting of yourself, of the capability of your body is very important. And starting from your 3D physical body self, to be able to like, okay, when I do this, I can trust that my body knows how to do this, I can allow my breath to move through my body and really just work through whatever I'm feeling. So it's creating trust in your body. It's using postures that stimulate your womb area, stimulate your womb space, to allow it to just function a little bit better, because everything functions better with movement, right?
Yes.
So when you have a stretched muscle and you don't feel like you won't be able to walk properly, when you sprain your back, sprain your arm, you need movement to the area to stimulate that part of your body so it works more effectively. And that's what fertility yoga does, is it just allows your womb space and your abdominal area to be massaged almost, so it works better and it reacts better to the treatments that you're doing. It reacts better to the pain that you might be experiencing. So like, for example, when you are menstruating, even when you're doing your fertility treatments, sometimes there is pain, and that pain can be helped and eased with the fertility yoga, because you just stimulate, you massage the area, and you just learn to use your breath as well, which is very important. And the most important aspect of the yoga that I teach in terms of fertility, prenatal and postnatal, is using our breath to carry us through difficult times when our body feels like it's incapable of handling what we're currently going through.
Sure. So the de-stressing is the most important, because I think a lot of our patients that come in have a high level of anxiety. So I suppose yoga would be one of the best ways to de-stress and to find their own selves. And do you believe in sort of mantras and that type of thing? Because that's something, as a heart clinic, we like to sort of focus on the holistic side of things rather than just the medicinal side of things. So is that something that you believe in?
Absolutely. Affirmations are very important, so your mantra, it's an affirmation that you repeat to yourself. And we use a lot of it in this style of yoga to just allow your mind to catch up with what is actually happening in your body, because we go through these processes that are hectic. And just reminding yourself that I'm capable, I'm safe in my body.
Yeah.
I'm whole, my body is ready to receive this baby. That is very important for your mind to catch up to what your body is doing.
Thank you. So Kirby, on to you. In terms of diet, I know that you are very passionate about sort of fertility boosting diets. So how does this assist in fertility or boosting fertility in some way?
So when we look at nutrition, we find that nutrition improves ovulation. We know that if we don't ovulate, we won't be able to fall pregnant, right? So we try and use nutrition in a way that we know is going to help support your inflammation and oxidative stress and any environmental toxins that we're exposed to, because we know that whole picture can interrupt your ovulation. So especially with women struggling with PCOS or infertility, when we sit down and we discuss the nutrition, we try and start at the foundation, because usually what happens is, from whatever resources they found, or if it worked for them, if it worked for a friend, it's going to work for them. Social media can be quite a dangerous place. So I find that just taking a step back and teaching them actually how to eat and what to eat will absolutely help, just in terms of regulating their cycle. It also takes quite some time, because you can't just correct your hormones in 2 weeks. So in terms of nutrition, we teach them exactly what to have, what to eat. There's certain ingredients that they're going to have to consume a lot more of compared to someone else, depending on their issue, whether it be PCOS or infertility. Both pictures has specific amounts of nutrients, specific amounts of dosages that we need to try and reach using nutrition, and then of course supplementation.
Yes, so of course as well, you can't really, I mean, it would be something, it's baby steps to make small steps to make a big difference, because obviously a large change would be detrimental rather. So
it's a process.
It's a process, absolutely.
Yeah.
And so I know this is difficult because it's a generalization, but what would an ideal daily meal plan look for somebody, who's trying to boost their fertility?
Yeah, it is a big question, just because I work in the space of personalized nutrition, and because we do genetics as well, we know that everyone's different, right? But we also know that when it comes to things like inflammation, oxidative stress, that can reduce your egg quality and your sperm cells, and it reduces the chances of fertility. We do look at things like anti-inflammatory foods, or rather, in terms of research, the Mediterranean space or Mediterranean diet, because we know if you're consuming a lot more fruits and vegetables and your whole grains and your legumes and your nuts and seeds and your poultry like your chicken and eggs, if we try and make sure that we are getting those foods in combination, the chances for fertility is much better. Of course, we also focus on things like your highly processed foods or your refined carbs, alcohol, trans fats, processed meats. So these are all things that we need to educate our patients on, because it does make a big difference.
Yes.
Because when we look at, in practice, we think we know what we should be eating or what is healthy. But when we sit down and I actually go through each and everything that they're consuming, and I tell them, this is what you should be doing, but this is what we are doing now, so how can we actually get there? Then their eyes tend to open a little bit and understand, okay, so I'm actually supposed to be eating enough. And that's also the problem I see in terms of, I guess it's just the diet culture, is that people are tending to undereat, so they're robbing their bodies of very important nutrients. So trying to get these patients to eat enough and enough of the right things, that's extremely important in terms of boosting fertility.
Absolutely. And I know you mentioned trans fats before, and I know that from convenience foods, a lot of people, because they're always rushing around, a convenience meal is always the first thing that they go for, pop it in a microwave. Can you just explain, number one, the dangers of trans fats, and number two, those convenience meals, the issues with those?
Okay. The problems with your trans fats is, because when we look at endometriosis or PCOS and infertility, we know the underlying, or one of the underlying factors, is inflammation. We know that your trans fats are not really anti-inflammatory by all means. So we're just going to, if we do have it on a daily basis, it's just going to make that whole process a lot more difficult.
And can I interrupt? Is trans fat, it's man-made fats?
Absolutely. So trans fats you'll get in your convenience foods or deep fried foods, or takeaways, the McDonald's and the KFCs, etc. So it's all those takeaway foods. So often I will explain to my patients, and they find that the convenience foods are much better. But again, once they understand how to eat and what to eat, they'll be able to adjust a little bit easier and make their own meals, especially when they feel the benefits. And that's always encouraging, because it's so easy for us nowadays to just go on our phone and order something.
Exactly.
Very convenient. Yeah. So, and then we're so busy all the time. So it's easy, but once my patients understand what to eat and how to eat, it's just up from there, you know?
Actually, it's reforming a relationship with your food, which is so important. I always say food is made with love, and in that respect, you have to get that relationship back.
Yeah.
Thank you. So Tara, back to you. You mentioned pre and postnatal yoga earlier. Can you just tell us what the difference is and what happens in both processes and practices?
Okay. So I want to start with fertility first. So when we're on the fertility journey, the movement allows us to massage the area, just open ourselves up to receiving the baby that we want, that we're calling in. We then go from that stage, and when the pregnancy is successful, there's a different way in which we need to move our body now to safely, allow the transition from fertility to prenatal to happen. So there's obviously certain movements now that we can't do anymore to protect baby in your uterus. I can also say, however, that there isn't positions that will make your baby fall out. There's not positions that will allow your placenta to detach, or things like what happens in your body is really such a miracle. It's really, if you look at how the sperm and the egg and everything needs to integrate to create this human life, it's really truly a miracle that can happen. So nothing that we do in terms of prenatal or postnatal yoga does have any effect on it. We are just a little more sure of what to do, from moving from one phase to the next phase. So in the season of prenatal and being pregnant, what we do is we then manage the symptoms that you are feeling. So your nausea, your heartburn, your lower back pain. And the sooner you start yoga, that's based on if you don't have any high risk, if you're not a high risk pregnancy, the sooner you start, the better, because you then have less symptoms as you go along in your pregnancy. So I find that moms who have started yoga at least at about 10 to 15 weeks of their pregnancy, if not obviously fertility as well, if they start between 10 and 15 weeks, they then seem a lot less big issues during the third trimester, when the belly starts to become really big, when lower back pain is kind of the mandatory thing that everybody experiences. But if you did yoga from fertility or from 11 to 15 weeks, it really does ease that symptoms that you're feeling. And it also allows you to have a better birth, a calmer birth, understanding what's going on in your body, and really honing in on being able to tell your doctor where exactly you're feeling something, where exactly you're feeling pain, because you start to understand your body at a new level. So yeah, and then postnatal is really just, after baby, healing, allowing your uterus to just go back into its place. Also managing the emotions a new mom has and the hormones a new mom has after birth, after having a baby. Usually we started between 4 and 6 weeks with postnatal yoga, but really just having a community, where you can come and you can say, my baby has cried all night, and I really am so tired. And you'll hear other moms say, like, I'm with you, my baby has been there, or my baby is there.
Yeah.
And I think that's the basis of my classes, really, is creating communities. So you start in a fertility community where you are all rooting for each other, you're all supporting through the highs and the lows, you are there for each other. From there you move into your prenatal section, where again you're in that same family, because you kind of carry these people through. And then postnatally, again, you meet people you were with on the journey, people that were earlier than you. And that's just how the community remains in a positive way, rather than having your social media. It's very true what Kirby says. Social media is it's a good thing and a bad thing, right? Because we tend to be attracted to the negative stories, what can go wrong, but you don't know what others are experiencing. And I think that is the most important part.
I think that's also what really amazing about HART as well, is that we don't actually look at the person in terms of, right, you need IVF and it's this treatment. We bring in a community of experts such as yourselves to bring in the holistic side of things, because it's a whole person. It's, the struggles through pain, anxiety, loss, trauma, and actually looking at the person from a nutrition point of view, from a skeletal point of view, from the holistic yoga side of things. So it is actually creating a community within the fertility world. And that's why, the hashtag Break the Silence is so important, because we need to talk about these things. It's very important for us all to have a voice. So I really like that. So Tara, in terms of anyone struggling with infertility but very unsure whether or not yoga would even help them, what is your advice to them?
I always say that moms generally come to me, and it's unfortunate, that they generally come when they have tried everything and it hasn't worked, and now they are like, what's left to lose? What have I got to lose by trying this last time? Trying this, trying a dietitian, trying yoga, trying coaching, trying this for one last time to see if it will work. And it's a nice space to be in, because when people come in with it's just the exercise program, they are blown away by the results that it brings. Because when your body is calmer, when you are less stressed, your body responds differently to your treatments that you are getting in terms of fertility treatments, and also just for the moms who currently cannot afford maybe going to fertility treatments yet, starting this process, because it's kind of the groundwork that you do for your pregnancy to come, for your parenting journey. It's emotional groundwork, it's really mental groundwork, it's physical groundwork. So this is really where the process starts, and that's why I'm so happy to work with HART, because you guys acknowledge that it is a starting point. You start from here and you move to the rest of the things that you need to do. So I think it's very important for the moms who are not at that point of it's all or nothing now, to understand the importance of doing this as groundwork.
Thank you. So Kirby, back to you. Your area of expertise is quite expansive and it's very interesting, but we are particularly interested in obviously your own experience with PCOS, endometriosis, well, not you, but your expertise in that field and infertility. So if you could just give advice to patients in terms of them struggling with any of these symptoms in terms of your practice, what would it be?
I feel like what Tara said, they'll come to her as the last resort, or they've tried everything. That's exactly how I feel. My patients will usually come to me after they've tried the IVF or after they've tried AI and nothing's worked, but they haven't seen a nutritionist or dietitian through that whole process. And I think, could someone not say something? So they'll come to me and they've already had all this trauma and emotional distress already. And if I were to think about my own experience, for me, I already had a little bit of, at that point when I was diagnosed, of a nutritional background. So it was still extremely daunting. So I can't imagine for someone who's just being diagnosed without any of that knowledge, it's just a lot.
Yes.
So in that instance, I will say you need to find a practitioner who specializes in that field, okay? And ask questions. I think we hopefully slowly asking more and more questions and not just taking the first recommendation. But also to mention, like I said to you, is hormone imbalances doesn't correct themselves overnight. And this means that the changes you made 3 months ago, it may only be valid now. And again, especially when it comes to fertility, it takes a lot of energy for an egg to be fertilized or implanted and grow. So that's why I always tell my patients, give yourself mentally at least 3 months, because your hormones take some time to improve. And this is why it's so helpful to monitor things like your basal body temperature or your energy levels or your digestion or your menstrual cycle, and your sleep and your stress, because you'll often see small changes in these areas before hormone changes.
Yes.
So before, it's also because it's so extremely emotional and it's an exhausting journey. I don't like to say be patient, because that would frustrate me, but many of us want to feel better right away. But just give yourself some grace and just some time, because your body takes a lot of time to heal, mentally, physically.
Exactly. And it's also about being kind to yourself, I think. And that's why I think that the whole sort of yoga journey and nutrition journey are so amazing together, because it's about being kind not only to your soul and to your heart and to your body, but also nutritionally as well. It's just it's a tough journey, and so yes, give yourself some grace is very, very important. And Kirby,
Angela, in terms of that, I also just wanted to say it's very important what Kirby is saying in terms of it takes a while, and it's actually you putting in work as well. It's easy for us to go to get an IVF, right? Because everything is done for you. It's just put inside of you. But I think we need to learn to understand that there's some parts where we have to come to the party as well, you know? So we have to come and you have to attend the yoga classes. You have to do the meal plan that you're getting. Because if we're just sitting around and we're not doing anything, you know, you are less likely to see results.
Yes.
I mean, I wish in the perfect world I could say, just eat this and tomorrow you are pregnant. It doesn't work that way.
No, it is a journey, and that's the truth. But also, Kirby, just in terms of if someone's trying to boost their fertility through eating healthily now, and their lifestyle changes are starting to take place, and they're doing their yoga, I know it's difficult to say again because I'm generalizing, but what kind of multivitamins or supplements would you normally recommend for somebody?
So supplements become very personalized when it comes to PCOS or endometriosis or infertility, because we need to understand what the root causes are of those conditions, and then if there's nutrient deficiencies. And also, if someone's on a contraceptive, for example, we know that it can deplete you of certain nutrients.
Yeah.
So that's where I start. I don't like to supplement unless I know your numbers. And often the picture is that we'll see low vitamin D or B12 or iron and magnesium and folate. So we know what to look for when it comes to those conditions. When we're thinking PCOS and fertility, the requirements in terms of supplements are very different. So for example, when we look at supplements like myo-inositol and D-chiro-inositol and omega-3 fatty acids and vitamin D or coenzyme Q10, the recommendations are very different. But I can't possibly, for example, for fertility patients, get in enough, let's say, myo-inositol. So then we would need to supplement. So I will use supplement in that way. If I can't get it in through the food, I'm going to supplement accordingly. So when it comes to things like a multivitamin, it's very individualized. And then we need to look at, are the ingredients active and what is the dosage? Because that's what I will typically do. It's rather targeted versus take a multivitamin and this is the best one.
Yeah, absolutely. Yeah. Okay, thank you very much. Yeah. Tara, so you're not only an expert fertility yogi, you're a parenting coach and a life coach, which I find interesting. Please, can you just elaborate? Tell us more about that.
So why I ideally actually started yoga, then life coaching, and then now most recently doula work as an emotional support for moms in labor is because I recognized how important it is in my own life and on my own journey, how important it is to have an accountability partner, to have someone that understands the processes that you're going through, and this person being able to just guide you. And as you're stepping out of alignment with what it is that you want, that person's there to remind you of the vision that you had. And if you no longer feel like your life supports your vision, we allow you to expand into another aspect of your life or another vision, because we're not the same people who we were maybe when we started our marriage. We're different now. Every 5, 6, 7 years, sometimes for people every year, you're a different person, you're a different human. And on this fertility journey, I find that you really need a parenting coach and a life coach to start you off with, because you need to understand that there's going to be ups and downs. It's not going to be a set in stone journey. If it is, wonderful, and we always pray for that, but it's not always that it's going to happen, so you have to become emotionally fit as well to be able to go on this journey. And people might say, a lot of my clients say, you know what, I feel so bad because people who don't want babies are having babies, and why am I struggling? So that's where we always get back to, is you look at other people, you try and look at your situation in comparison to other people, and it's not healthy. It's not good for your emotional health. So in doing the body and the physical work, I really recognize the importance of being emotionally fit to go on this journey of parenting. Absolutely. And even throughout your pregnancy, having an accountability partner to tell you that it's not all doom and gloom. There are days when my clients feel like, can this baby just come out? I've wanted it for so long, but I'm actually feeling so bad, my hormones are ranging, I'm emotional, I feel irritable, I just feel like I hate this partner that put me in this situation. And just having that person to talk to and a community that understands. So it's really an important aspect, and I think I recognize that in my own journey, is that when we look at many years ago, hundreds and thousands maybe of years ago, there was more communities when you gave birth, or when you get pregnant, you had communities that stood with you. After you gave birth, you had people that would wait on you. There were all these midwives and mothers that would be supportive of you on your breastfeeding journey of this and that. But our life has just become fast-paced. We want quick fixes. We want things that work, and it must work now. We want a tablet for everything. Yep. We don't want to sit and think about our emotions and how we feel. And at the end of the day, it does come back to haunt you. It really comes hard and fast, and you end up finding yourself in a situation where you can't run anymore. So that's where the life and parenting coaching really comes in, because we really guide you on your journey, and we're there to hold your hand. We don't have people who hear us, who see us for who we are, without judging us for where we've come from or where we want to be. So just taking you, come as you are.
I like that. So obviously with the whole COVID pandemic and things going on, people are a bit concerned, especially people who might be wanting to fall pregnant or who might already be pregnant. Do you offer online courses? How do you work, Tara, in terms of your classes? Do you have group classes or one-to-ones or?
So for COVID, we have moved most of the classes online. So we went through a phase where everything was online. When everything started easing up, we went back into in-person, and now we're back. But it's always now online and in person. Okay. And it's not classes that are pre-recorded, or it's, like you can see me, but I can't see you. It's live on Zoom. So just like we are right now, it would be how the class is. So I can see you, I can correct you if you are doing something wrong, or your body posture is not in alignment. I can say, Angela, just shift your back, do this, do that, straighten your back,
Okay.
So it's not for the cheaters that, we all do it when we,
Can't hide from
when we watch when we watch a video, and I often do it in my own practice,
Okay.
when I'm just tired and I'm watching a pre-recorded video, I can lay there and nobody will say hello, are you okay? Whereas when you're on Zoom and it's live, I can be like, are you okay? And for prenatal especially is the importance of checking that the mom is comfortable, so I get very in tune with how you look, how your facial expression is, because if you are feeling like you can't handle the pose or you're feeling any pain, I can pick it up immediately, so we don't harm you, so we don't do more bad than good.
Okay.
So you're always basically watched, you're always heard, you're always seen by me, by the community of moms or moms to be that is in the class. So and coaching we do one-on-ones. I have some group sessions that I also run, but everything is really made now to be online. I think we were forced to.
Yes, absolutely. I've actually just got a question in on our feed from Munebe Mohammed asking where she can go for yoga. Where are you based, Tara?
So I'm in Johannesburg, but all my classes are online as well. So she can just contact me, check out my page, or just send a query to HART, and then you guys can direct her to me.
Perfect. And also what we'll do is we'll actually send your contact details once we've done here, then we can send your contact details on. So that's great. Maybe back to you also in terms of your sessions with patients. Do you have one-on-ones, and or do you also offer Zoom sessions with your clients?
So we do one-on-one face-to-face consultations, and of course with COVID I do online consultations as well.
Okay.
And I also do PCOS programs, so it's still an individualized program, it's not a course. So I'll still be able to see you online or face-to-face. And that's a 3-month program.
Okay.
You'll be seeing me every 2 to 3 weeks for 3 months.
Okay, perfect.
Yeah.
And then you do personalized meal plans, is that right? So
absolutely.
Okay.
So they'll always receive a personalized meal plan depending on what they what the problem is. And in terms of booking, it's quite an easy booking system. It's on my website, and they can go and explore.
We'll share all those details. And we're quite excited also to announce that Kirby, you are creating a recipe book for us, a fertility boosting recipe book for HART, exclusively for HART, which is amazing. So we will be sending out those details and obviously marketing that quite extensively.
Amazing.
And Tara, you as well, you are very kindly offering anyone who's watching and anyone who's following our Facebook page to have an online intro session with you. So I'll get that Zoom link from you in the next few days that we can share with everybody.
Absolutely.
Do either of you have any final comments or anything you'd like to share?
I want Kirby to go first, but it's all right.
I'll go.
Okay.
Or just look pretty.
No, I just wanted to say I'm so glad we're creating this platform because when I found out I had PCOS, I didn't really know many people who had the same problem. Whether it be PCOS, endometriosis, fertility, it's just something that is not spoken about frequently, and there's not much awareness to that. So I'm so happy that I've joined HART and that we are doing this together and that we are creating a community, because I feel that specifically these patients, they need so much more emotional and mental support because they've been through so much. So I'm just so happy.
we appreciate having you on board as well. Thank you. Laura?
My turn. I'm also very grateful for being with a community that's medically accredited, but also understand the holistic side of it, because we don't often have it. You think you are left to medicinal solutions for every problem that you have. And I think HART is just amazing at doing that, at combining the holistic side. And I think the focus on emotional well-being, which we really need in this world right now, because ever since lockdown and COVID-19, we have seen, in terms of me speaking as a coach, as a doula, we have seen a lot more cases where people really need the emotional support, because mental health was overlooked so long, and I'm very glad we can offer this to moms, because you're at an imperative stage of your life where you're wanting to bring another life into this world, and it really requires emotional and mental capacity. Yes, we need money capacity, we need time capacity, we need all of that, but we also mustn't take for granted the fact that we need the emotional and mental capacity as well, to be able to go through this journey, even the journey, like you say, Kirby, with PCOS and endometriosis and all of these things. It's tough, it's tough on our minds, it's tough on our mental health well-being, and not having
no, sorry to break your word, Tara, go ahead.
No, as I was saying is, when we don't have people to talk to about this, and people who can give constructive advice, we look at things that we read, we look at negative stories, how that doctor is a miracle doctor. You go to that doctor, and it doesn't mean it's going to be your miracle doctor, so just having somewhere where you can speak constructively about these things, I find is so important.
I also find once you are mentally prepared to go through this journey, it is a much better transition, because it's much easier then to make the changes. But mentally, if we're not really supported, it's extremely difficult to get through and to actually make the changes. I see that so often.
Yeah, I agree. Well, ladies,
especially with something like diet,
Absolutely. It's extremely difficult. It's a mental shift. That's what it is. Because I'm having to declutter in terms of social media, or just declutter all the information that's been done and that's been trialed for years. And then we speak about, okay, what you should actually be doing for your body right now versus trying all these different things.
Yeah, it's sort of rewiring the brain, isn't it? Because,
exactly.
A lifestyle, this is what they've done. And then you're telling somebody that the way that they've been doing something for so many years is not right. It's
big.
Yeah.
Yeah.
But ladies, I've had such an amazing time talking to you. I'm so happy to have you on board with HART, and we just love the work that you're doing, and support you wholly and fully. And yes, what we'll do is we will share all of your details on our Facebook page after this, so that patients can get hold of you. We've had somebody else on Facebook just pop up and say that it's just been a fascinating and an amazing talk. So thank you so much for making that happen.
Thanks, Angela. Thank you so much.
Pleasure. Have a wonderful weekend.
You too, guys.
You too.
Bye.
Bye.